Well, I see the clinical benefit of Synapse 3D in finding preoperatively already some abnormalities of the pulmonary vessels. There are a lot of variations in pulmonary vessels, and especially for younger surgeons who are not so familiar with the anatomy, it is easy for them to look at the Synapse 3D system, at the CT scans, and recognize where the pulmonary vessels are and if there are any abnormalities. Nowadays we have a lot of patients that have small lung tumors, and small lung tumors are easy to be operated on by VATS procedures, so video-assisted thoracic surgery. In VATS procedures, it's a little bit more difficult to identify all the pulmonary vessels, and if we have abnormalities there, it is very beneficial of the system to know already beforehand whether there's any abnormality to be expected. In patients that have small tumors, we also can perform not a complete lobectomy, but segmental resection of the lung. And if we have the information about where the vessels are going to, like the pulmonary artery branches or the branches of the vein, we can exactly plan the operation in order to find out which segment should be resected, and if there's only one segment or more than one segment that needs to be resected. So that's one of the beneficial things of Synapse 3D. I think with the system we really increase safety for the patients during the operation, because if surgeons know beforehand that there are any varieties or abnormalities in the pulmonary vessels, it is beneficial for the patients and the safety of the operation, because the surgeons know what to look for and is not surprised during the operation because he or she discovers a vessel abnormality that is not known beforehand. Well, the workflow benefit of Synapse 3D is that it is quite easy to be used, it is user-friendly, and it is also easy for younger surgeons to use it and to easily identify the lobes, the segments, the vessels, the pulmonary branches of the artery or the bronchus. It helps especially young surgeons to identify any abnormality beforehand, and that is helpful if you go into a surgical case and you know the anatomy already beforehand and you know exactly where to go and which part of the vessels you have to remove. Well, from the radiology department, we need very thin sliced CT scans in order to analyze them in the Synapse 3D system. And if the radiology department provides these thin slices, it is very helpful and it is easy to be analyzed in the Synapse 3D system.